And for that, let me introduce to all of you the guest of honor for this prestigious conclave for the inaugural session. We have with us Dr. Vijay Kumar Saraswat, Honorable Member, NITI Aayog, Government of India. We welcome Dr. Saraswat. Thank you so much for joining us today in the inaugural of second edition of APAC HealthTech Innovation Conclave. And Dr. Saraswat doesn't need an introduction. He's one of the distinguished scientists with vast experience in different research in both basic and applied sciences spanning several decades. He was also the Secretary of Defense Research Development Organization, and he has played pivotal part when we talk about evolving concept document for setting up the Indian Railway Research Institute, or also for the energy sector in India. He has got vast experience when it comes to various angles of policy. And Dr. Saraswat will be talking today about the digital strategies for transforming public health in India, technology, governance, and service delivery. Before I hand over the session to Dr. Saraswat, let me quickly take a minute to give an overview of what APAC News Network stands for. APAC News Network is a community building, knowledge consulting media company focusing on creating awareness for the importance of innovation and technology for governance, healthcare, education. We are working closely with various ministries in Government of India, state governments, embassies, and also industry and startup ecosystem. That is what all about APAC News Network. So without taking much time, let me welcome Dr. V.K. Saraswat, Honorable Member, NITI Aayog, Government of India, in the inaugural of second edition of Health Tech Innovation Conclave organized by APAC News Network. We welcome Dr. Saraswat. Your thoughts on digital strategies for transforming public health in India, technology, governance, and service delivery.
Thank you very much. Thank you very much, Dr. Goswami. And I'm very, very happy to be part of this discussion today. And my greetings to all those honorable members who have joined us, and a large number of people who are participating as audience. This is a great platform to discuss the health issues, public health issues, particularly the introduction of digital strategies for transforming public health in India. I'm going to talk to you about this, keeping in account what exactly is the present situation in our country as far as the health is concerned. We had this Piramal Foundation, which is this kind of a survey for us in NITI Aayog, and we found that public health scenario in India is rather, I won't say it's not a very happy situation, because if you look at the number of indices which actually identify whether you are okay or not okay, India ranked 130 on the Human Development Index. That is our one of the major things, in which health is one of the indicators. And in terms of doctors, if you say one allopathic government doctor on an average attends to a population of 11,000 patients. 1.3% of the GDP is spent on the public health care spending. That is lesser than global average of 6%. When it comes down to the women, particularly in the belonging to the tribal population, 65% of the women belonging to the tribal population are anemic, against 46.9% in the general population. Then it comes to mortality of the children below the age of 5, it is 50 per 50,000 live births, and 61% higher in tribal areas. When you look at our immunization record, immunization coverage is 60% among the children between 12 and 23. And the maternal mortality ratio is 130 per 100,000 live births. So this is the general statistics as far as the health scenario of our country is concerned. Now, what are the challenges which our country is facing? If you look at the health challenges, there's a major neglect of the rural masses. 75% of the dispensaries, 60% of the hospitals, and 80% of the doctors located in the urban areas. Poor health infrastructure, if you look at it, government hospital bad patient ratio is 1:2,046. Doctor-patient ratio is 1:10,189. Straight on hospital citizen ratio is 1:90,000. These are the numbers which are quite alarming. Then we have low level of health insurance, 32% government contribution, 15% penetration. Shortage of medical personnel, almost over 600,000 doctors and 2 million nurses are short. Health challenges, in other words, affordability. Actually, that is one of the major issues. 1.28% of GDP. This is the budget estimate of public expenditure. 65% patients pay out of pocket. That means that is the way we are spending our money. Expert in lifestyle diseases, 200 million people suffer from chronic disease, 100 million suffer diabetes and hypertension, and 13% per year growth in patients. What are the initiatives the government of India has taken? In the recent past, we have started some very good schemes. Among them is creation Ayushman Bharat, which is creation of 1.5 lakh health and wellness centers, rupees 5 lakh healthcare insurance coverage for almost 100 million underprivileged families, intensified mission Indradhanush 2.0 for full immunization coverage in 272 districts across 27 states and union territories. Then National HealthTech proposed digital framework. That is from where the today's discussion starts, that India has already taken major initiatives on creating digital HealthTech. The framework powered by artificial intelligence, machine learning, big data analytics, and holistic platform supports a multitude of health verticals. Government is ramping up number of skilled professionals for doing this, particularly conversion of 75 district hospitals into medical colleges by 21-22 in underserved districts, which leads to creation of about 15,700 more MBBS seats. Other initiatives are Kilkari free audio messages about pregnancy, childbirth, and childcare delivered on mobile phones. Mobile Academy free audio training course for accredited ASHA workers. M-Session, that is a support for quitting tobacco use. TB missed call initiative, counseling and treatment support for services for the TB patients. Then we of course have Rashtriya Swasthya Bima Yojana, where financial risk protection to underprivileged families has been provided. Then we have Surakshit Matritva Ashwasan, that is Suman, free health care for pregnant women, newborns and mothers up to 6 months of delivery. So with this kind of a background and the initiatives that the government of India has taken, today's topic becomes very, very relevant, because we have to force multiply our reach, our services, our affordability, our accessibility, and that is through the digital health, which is creating a seamless online platform through the provision of a wide range of data, information and infrastructure services, duly leveraging open, interoperable, standard-based digital systems, while ensuring the security, confidentiality, and privacy of health-related personal information. And what are the objectives? To bring efficiency, to bring accessibility, to ensure inclusiveness, nobody should be left out, and it should be affordable, timely, and safe. These are some of the objectives of the digital health. And the digital transformation and healthcare we provide, it is basically a patient-focused system. It's not hospital-focused system, it is patient-focused system. It is also depending upon prediction of the diseases. In prediction of therapy outcomes, it should be able to tell us. It is also for drug adherence. It is also for optimizing the drug dose. And it is also for finding patients for clinical trials. That is what happened in the pandemic, when we were trying to see all our drugs, repurposed drugs and vaccines. So this kind of a platform has helped us a lot. Use of augmented reality and virtual reality in treatment and surgeries. You have seen now robotic surgery is becoming a very common thing. This morning only I saw a large number of robotic patients, even in Apollo Hospital, where recently Dr. Sangeeta Reddy was mentioning that they have done number of operations, heart surgeries using the robotics. Creating digital twins, that means you should be able to simulate even before you touch the patient. And infection surveillance, which can be done through this, and garage biotech, which can be created. So this is a huge transformation which can be brought in through the digital transformation. If you decide the smart healthcare as we talk right now, we can say that it should be on services, medical devices, connectivity technologies, system management, applications, and end users. For example, if you take medical devices, you can have on-body sensors, stationary medical devices, which are also used for identifying the patient's problem. And of course, the two types of sensors like in vitro and vivo sensors, which can be on your body. Then connectivity, of course, in today's world, when we have all the modes of connectivity, right from Wi-Fi to satellites, all of them can be made use of. System management is very important here, because it requires database management, it requires remote management, what is happening in the districts, in the towns and all that. and also managing the network efficiently so that there are no breakdowns and there is enough speed available, enough data storage available, and things like that. And most important in the management of the security of the network, which is very important. And finally, for the end users, it is the individuals who get benefited. It is the hospitals who come into the play. It is the government organizations which will be able to do the policy and other initiatives put it on, and clinical research institutions which can do education, research, and dissemination of information, and large number of diagnostic laboratories which can provide the support for the patient's diagnostics and so on. So that is the entire network of smart healthcare which can be made possible through the digitalization. Now, healthcare ecosystem of the future will be centered on the patient, as I mentioned to you. In this, the supports payment and financing, in which payment structuring and financing can be done. Financial data it can handle. It can also handle the social data in terms of transportation services, ambulances, faith institutions, community, family, a kind of a support. Basically, it is advanced analytics and a health platform which actually provides, and it is provides generated data. For example, connects consumers with the traditional modalities of core pharmacy, hospital, ambulatory clinic, specialist, care team coordination, diagnostic tools, scheduling of your appointments, and quality of service. Health and wellness data, it also tracks daily life of what is your nutrition level, what is your fitness level, and so on. It can also do patient-generated clinical data, integrates home, near home, and virtual care services. For example, self-service solutions, what you can do at home that can be advised. Monitoring the tools for the old patients and all that you can monitor remotely. Compliance and adherence tools, whether the drugs have been taken, TB patient has really adhered to the kind of drug schedule which has been provided, virtual care and retail clinics. So this is an entire patient, social, financial, health, entire platform which can provide the kind of services which we are looking, and the best of the doctors can treat remotely, sitting in the corporate hospitals or the government hospitals like AIMS, and also provide the services in the remotest and the farthest place. So the element that shape the governance of digital health are, one is the challenges which we just discussed, starting from the epidemiological profile, what we are today seeing, whether the third wave is there or not there, more frequent use, new health technologies which will come inside. These are all changes. Citizens more aware of their rights, and rising expenses, which is another challenge. Improving quality, that is another one, and inefficiencies which are there in the system. These are the challenges which needs to be taken care of through the digital health, in which government has got a major role to play, which is Ministry of Health and Ministry in charge of digital, and they have to create the digital strategy, health strategy, and digital strategy. And there are laws and incorporation of the information communication technology in the health system. And for that, data centers, servers, all have to be in place, connected to the governance of the digital health systems, hospitals, primary care centers, and citizens. This is an entire network in which government provides for the strategies which are incorporated, important, and also provide the basic ICT network for ensuring that the challenges which we have faced are mitigated and we have a very positive healthcare system. The Internet of Medical Things technology which is emerging today is a major thing which is going to make an impact on this. To give you a picture, 3.7 million devices in use today, connecting to and monitoring various parts of the body. And it monitors medical conditions specific to patient's disease and other systems, conditions such as heart rate, blood, sugar, exercise, etc. And then smart software support device iteration based on data input deliver the best patient therapy. Actually, you also have the active implantable medical device controls stimulation or precision medicine therapy to treat disease and improve patient quality of life. This is possible today. One Internet of Medical Things system solution collecting data from medical devices, medications, and biometrics to modify therapeutic window towards best care option. That is possible. And that is possible because today we have 97% of Wi-Fi adoption and 10% connectivity of Wi-Fi to the medical devices, which will result into optimized result for the patients, optimized result for the healthcare professionals, their families, and healthcare systems. So these are all major benefits of the what we call the Internet of the Medical Things. So 10 big advancement in healthcare technology during the pandemic, which were noticed. We were able to do predictive analytics. Business intelligence and analytic platforms got active. In fact, I personally received large number of offers from various people who have developed apps for providing these services, particularly monitoring the spread of the pandemic and so on, and also taking care of the patients, and also looking at what are the lacunae in the services which are being provided and fulfilling the gaps. So this kind of a business intelligence and analytics platforms have been put in place. Digital front door, which is what we are talking of, telehealth and 5G expansion, which is happening today. Telehealth, and with this 5G, I think in the peacetime we will be able to expand the services to the remotest corner. Then what is artificial intelligence chatbots, robotics, digital contact tracing and interoperability, which is available in this, and remote monitoring and wearable devices, which will become part of the system. And for ensuring that we have the prosthetics and things like that, 3D printing, and most important thing is that what is the quantity of medicine and what is the quality of medicine, what is the precision medicine that can be taken care of. So all this is feasible, and these advancement has come in the last just about 1.5 to 2 years in our health system today. There is another thing which is happening is the e-pharmacy and e-consultation received regulatory recognition during this time. Commercial and private establishments shall be closed down during lockdown with exception of delivery of all essential. That was the kind of thing which happened in March 24. E-consultation regulated to prescribe medicine. Ministry of Health Welfare. Medicine groups defined according to the mode of consultation. So telemedicine practice can prevent the transmission of infectious diseases. Then, of course, Jan Aushadhi's Sugam mobile app, which was put in place, e-consultation services launched by multiple government. In fact, AIMS and JIPMER and things like that, all of them were in a position to provide e-consultation by multiple government hospitals during the COVID time. So in terms of future, of course, we are all talking of the COVID and pandemic and so on, but actually what we are entering into is health 4.0. So when we talk of health 4.0, what are the maturity indices we are looking at? We are looking at resources with digitalization, workforce 4.0 available and qualified. We should have entire work stream right from the super doctors to the ASHA workers. They should be completely digitalized with respect to the usage of the various platforms. Next one is the organization and processes. So holistic control strategy, life cycle management should be put in place using the information technology system. Then, of course, information systems, which are holistic value network, integration and traceability. As I mentioned to you, very, very robust system of data centers, servers, and communication networks, which are required up to the last mile connectivity. Of course, culture. Culture is very important because we are transforming from what we used to be face-to-face kind of a healthcare system, and that is important. So communication and decision making, there has to be trust which has to be done, and that can happen only if the platform has got tremendous data integrity by design, so that there is no data fouling and there is no data misuse and privacy is maintained. So the interventions to overcome the health system challenges are intervention of known efficacy, that is low demand of services, we have to jump across that. Poor adherence to guidelines, we have to again jump across that. Insufficient supply of commodities, insufficient supply of qualified health workers, geographical inaccessibility, all this has to be done to provide a quality and coverage of health interventions. That has to be done. So what is the advantage? Applications of big data and AI in health tech. Actually, this is a major intervention of technology which is going to provide tremendous support, and already the fruits of this have been seen during our pandemic season. Diagnostics and decision support, which is basically to analyze electronically the health records and other data to assist the healthcare providers with diagnosis, decision making, and implementing evidence-based clinical guidelines at the point of care. That is the most important part. Then, of course, chronic disease management combined with remote monitoring tools. Then task augmentation or automation. Machine learning will displace the work of radiologists and anatomical pathologists who focus on the interpretation of digitized images. In fact, we had seen some of the foreign firms from like Israel who are in a Inox, which is able to now give you the complete study of a CT scan using the automation augmentation, and you get whether you are level 3 or level 4 in your lung infection and so on. Bioinformatics uses big data to identify correlations between gene sequences and diseases, aid in the design of novel drugs, and tailor treatments to individual patients based on their DNA sequences. Population health management, this field focuses on the use of aggregate patient data and big health data to manage population health. And public health emergencies, all of us know about it, that the best can be handled through the digital network. So future of health tech for making India Atmanirbhar Vision 2030, which the government of India has given, is telemedicine, point of care diagnostics, patient education and awareness platforms, self-health management enablers like democratize the empower health seekers, lower the cost of care by avoiding hospitalization, affordable medical devices, greater emphasis on building innovative, low-cost and portable medical devices. And of course, we certainly would like to encourage more and more Make in India. And electronic health records and analytics. I want to mention in NITI Aayog, when we were trying to do this exercise, one of the major handicaps we faced was the data gap which existed. Because what is happening in large number of states, there was no data coming. And as a result, to assess what exactly is the gap, it was a major exercise. That's why we had to put in a number of agencies to do the survey and come back with the data during the pandemic. And it was a Herculean task. But fortunately, some of the agencies worked very hard, and we are in a position to now make better assessments. Basically, whole idea is that by 2030, we should have accessibility, affordability, and quality in our healthcare. The time frame for commercialization, maturation of top 20, 25 technologies is like, for example, we have now variety of these things which are recorded, and you can see three circles in this. One is inner circle, which what will happen between 2015-20. Then there's the second circle, which is 2022 to 25. Third circle, 25 to 30. And fourth circle is outermost, is about 2030 to 2035. And all the technologies which are important will get matured by that time, whether it's digital avatars, 3D printed medical devices, enhancements, prosthetics, surveillance tools, AI, precision medicine, embedded sensors, or 3D printed drugs, or brain-computer interface, or nanorobotics. My dear friend, these are the technologies which will become part of your entire e-health system, which will make us affordable, efficient, and point of care. So to make the digital transformation of the health system, governments must take the following steps, among others. These are some of the discussions which we are holding. Declare digital health a national priority. We should provide precise, clear, and public support for the digital health strategy. Give digital health multi-year funding. We should not say only this budget I will have. Make sure the digital health and digital agenda strategies are consistent with each other. We should not have too many deviations. We should have a harmonized system of digital healthcare. Promote training of our IT engineers. Promote training on the digital health for IT engineers and health personnel. Ensure connectivity for hospitals and other health wherever there are gaps today. Centers and services, and equip them with necessary infrastructure. Promote and pass laws needed to grant legal certainty to all stakeholders. So the way forward is what industry need to do: increase R&D activity geared toward developing products suited to the Indian market. We want to collaborate with the ICT companies to bring the fruition of frugal approaches to innovation. Partner with government and healthcare providers to reach out to the masses through affordable healthcare delivery models. We should engage with the government and academia to develop relevant courses that will develop required skill base for the industry, develop training institutes, collaborate with healthcare providers to promote training and education of physicians and other technical personnel in the area of medical technology through continuing medical education. Involve healthcare providers in the innovation process, namely associate with physicians for obtaining specific inputs on product development. We should also strengthen the industry network association to promote awareness about innovations, share industry best practices, and encourage overall development of the industry. And we should engage with insurance providers to expand healthcare insurance coverage for medical technology products. So these are some of the ideas I have, and I hope this platform, what you have created, will be able to have good discussions with all the doctors, the industry partners, and take some of the ideas which we are trying to bring in and make our e-health system very robust, very efficient, and accessible to all. Equity is the big buzzword. The kind of challenges which I mentioned to you should vanish. The kind of gaps which I mentioned to you should also vanish. We should reach to the last person in the
Right.
rural healthcare, ensuring that he is also getting the kind of services which the urban population is getting. Thank you very
Right.
much.
Thank you so much. That was Dr. Vijay Saraswat, Honorable Member of NITI Aayog, Government of India, for sharing his vision. He outlined that what is the public health sector in India at present, what are the healthcare challenges, and what are the government initiatives, be it Ayushman Bharat, Indradhanush, National Health Stack, and how AI, ML, and big data and robotics is going to be the game changer in future. Uh, and also, he talked about the future should be more on patient centric, and the core idea of public health management through digital intervention should be accessibility, affordability, and using ICT tools. Thank you so much, Dr. VK Saraswat, for sharing your vision with us. I'm sure the audience present here today and who will be also watching it later will get a lot of insights on the thinking and rationale behind India's transformation for the healthcare sector using digital interventions. Thank you so much.